Hello guys, welcome back to the channel. It's Unit-8 Part H. C-section or caesarean section, also known as caesarean birth. It is a surgical birth of the baby where we will cut, the cut is known as a incision. We will cut the mother's uterus and we will take the baby out. When normal vaginal birth is not possible, we will go with C-section. If there is any complications like breech presentation, malposition or any obstructions, we will go with C-section. And this C-section is performed in various type. This two type is the common one. One is horizontal cut and other is vertical cut. And this T-shape cut is very rarely performed, but still this is also performed. We will perform C-section only if C-section is the healthiest option for the mother to be performed. Indications of C-section. If there is any problem in the structure of pelvic like CPD, or if the muscles are not working properly, the contraction and the relaxation is not in the correct proportion, it will damage the muscles, membranes, and even it affects the baby also. So normal delivery is not possible. Neoplasm obstruction is extra growth of any muscles like tumors are present in the uterus, then normal delivery will affect. Malposition and malpresentation of the baby, and if there is any previous uterine surgery, if there is any previous scar present, it will affect the contraction and relaxation process. Complete or partial placenta previa or placenta abruptia, any condition related to placenta will affect the normal delivery, like premature separation of placenta, cord prolapse, this condition, and fetal distress. Fetal distress in the sense there is a pressure on the baby, that baby can't breathe properly, or there is a pressure that is leading to injury to the baby, that is fetus distress. These are the indications for C-section. Management of C-section. First, before delivery. When the patient comes to hospital, we will collect the history, previous data, height, weight, vital signs. After collecting personal data, we will inform the patient about the procedure she is about to undergo. Like what are the pains she will undergo physically, abdomen, back pain, private part pain. And emotionally support is very important. Apart from this, to reduce the infection chances, we will clean the area and then take the women to the delivery ward. While checking vital signs, do remember there is a lot of chance the woman might get hypertension because of anesthesia. To reduce that, we will give 50% of dextrose in the IV. And next, as a precautionary measure, we will take the mother's blood group and we will arrange the blood before itself. Because due to delivery section, there will be a lot of blood loss. To match that, we will arrange the blood before itself. And before taking her to the delivery ward, we will make sure at what time lastly she had her food, lastly when she drank the water and all. While collecting the previous history and all, we will get to know for what drugs the woman is allergic to avoid it. After delivery, the first hour, we will keep on check the vital signs to make sure the mother is okay, there is no any complications. Like for every 15 minutes, we will check the vital signs. In second or third hour, for every half an hour, we will check the vital signs, and then after hourly checkup is okay. Daily, we need to make sure the fundus position is okay, the uterine condition is okay, it's healing, the pain is getting reduced. We need to keep the checkup daily. And after the delivery, that is in postnatal period, leukia will be excreted. We need to check whether the consistency is correct or not, whether the color of it is correct or not, to make sure there is no any complications which might occur later on. Next, dressing. We need to make sure that while dressing, hygiene protocol should be maintained. Because of crossing the hygiene protocols, there is a lot of chance that infection might occur. Even pus formation might occur. So we need to take care of it. And we need to record the urine output, bowel pattern, bowel sound and all. And pain measurements must be done. If pain is increasing day by day rather than reducing, we need to inform about this to the doctor. If patient has any breathing problem like difficulty in breathing or shortness of breathing, we need to immediately inform the doctor about it. And we should make sure that mother and fetus bonding is very good. Like kangaroo mother care, we need to provide kangaroo mother care to make sure the bonding between mother and the fetus is good. This is the management of the C-section. Indication of labor, which means we are initiating the labor, we are starting the labor. The labor is not occurring on its own. We are starting it either by providing oxytocin or other drugs or by artificially rupturing the membrane. We are starting the labor. That is induction of labor. And here we do have two types, that is elective induction and indicated induction. Elective induction is the patient doesn't have any medical cause or any reason. Just for convenient purpose, the doctor, the physician, one who perform the delivery, will induce the labor. While indicated labor, we perform it to avoid the other high risk complications which may further affect the delivery. To avoid that, we will induce the labor. Maternal indication, if the pregnancy is not occurring on its own on the given date, that is expected delivery date will be already predicted. If it's not occurring on that date, we will wait for 1 week. If it's not occurring on that period, we will induce the labor. Apart from this, if the mother has any underlying disease condition or any condition, then induction of labor will occur. For example, preeclampsia, polyhydramnios, if there is any premature rupture of the membrane or any previous history of death of the baby inside the womb, if mother has diabetes or any heart or reproductive system problems, or antepartum hemorrhage, that is bleeding before the birth, that is antepartum hemorrhage. This congenital malformation of the baby is actually fetal indication, it's not here. This is maternal indication. Fetal indication is the conditions that is seen in the fetus. If fetus has any problems, like fetus is not in the stable position or there is movement restrictions, the baby is not able to move, or else if fetus is not grown properly or fetus is dead, then the fetus can't proceed the delivery. We need to induce the labor. And post maturity, you know, the premature baby, the baby which is born before the due date, that is premature. If the baby is not born on the due date, it is borning after it, that is post maturity. And if mother and baby has different types of RH groups, then we need to induce the labor. These are the conditions at which the induction of labor occurs. Bishop score, based on this score, we will get to know whether the delivery process is going in normal condition or the vaginal delivery is okay, or else we need to find some other mode of delivery, or oxytocin induced is okay, or we need to provide more oxytocin. Everything we will get to know based on this Bishop score. And we have your scores 0, 1, 2, 3. And based on this topics, we will calculate the score. Cervical dilation, cervical length, consistency, position of the baby, head station and all. Total we have 13 marks. For 13 marks, we will calculate. If the patient gets 6 to 13 marks, then the delivery process is okay. It's going in the correct path. While if it is less than that, that is from 0 to 5 score if the patient get, then the delivery section is not okay. We need to take care of it. First, cervix dilation. When the baby is inside, dilation is opening of the cervix. When the baby is inside the womb, the delivery has started, but still the baby will be inside the womb. So there is no change in the cervix. No dilation. So first will be closed. We will give 0 marks. While further, when the baby starts to move on, the cervix starts to open 1 centimeter, 2 centimeter like that. When it starts to open 1 centimeter or 2 centimeter, we will give 1 mark. In further 3 to 4 centimeter, it will be opened. At that time, we will give 2 marks. In further, it will get 5 centimeters and more than that, and baby will be born. At that time, we will give 3 score. Next, we have cervix length. This is the cervix length. When the baby inside the womb, there is no change in this length. This length will be more than 3 centimeter, or for some patients it will be 3 centimeter. At this time, we will give 0 score. When the baby starts to move down, this length of the cervix will get reduced. You can see here, when the baby starts to move, the length of the cervix is reduced. Now the length is 2 centimeter. Now the score is 1. When still the baby starts to move, this 2 centimeter will get reduced to 1 centimeter. At that time, we will give 2 score. And further, it will get opened up like this, and then the baby will be born. At that time, we will give 3 score. Next, Consistency. Consistency is how you feel, how the cervix it is. First, it will be rigid or firm. Like if you touch your nose, tip of your nose, then you will get to know. That is how the cervix will be felt. In further, the delivery continues. This cervix starts to become very softening. It will become soft and then the baby will be born. When the cervix starts to get little bit softer and then softer, we will give based on that score from 0 to 1, 2 and all. Position. If the baby is inside, that is posterior, we will give 0 score. When the baby is in the middle way, we will give it 1 score. When the baby is head is visible, that is anterior, we will give 2 score. Head station. When the baby is inside the womb, at that time it is -3. When the baby's head is visible outside and it is going to born, at that time that score is +2. In the middle way, the score is -2, -1, 0 and all. The baby is inside. At this time it is -3. We will give 0 score. When baby starts to move out little bit, it's here, then the score will be -2. At that time we will give 1 score. When still the baby comes out little bit down, at that time -1. At that time we will give 2 score. And lastly the baby's head will be visible and it is about to born. At that time +1 or +2. At that time we will give 3 score. By calculating all this, you will get Bush-up score and will get to know what is the condition of the delivery it is. Methods of induction of labor, we have 3 types: medical, surgical and combined. In combined, if you see, medicine plus surgical is the combined method. In surgical, we have artificial rupture of membrane and striping of the membrane. Here what happens, the doctor insert his hand inside the vagina. In the circular motion, he will insert his hand inside the vagina. He goes in and he leaks the amniotic fluid. When amniotic sag is removed, amniotic fluid starts to flow, then automatically delivery will get started. This is how surgical method is performed. And medicine, it is very important. Medical method, we have 2 types. One is oxytocin induction and other one is prostaglandin induction. Oxytocin. See, oxytocin is not the same amount that is given for all women. Based on their condition, based on how the delivery is going on, at that condition we will provide the oxytocin to the patient. We do have an options like 1 unit, 2 unit, 3 unit and 4 unit. We will provide it with 500 ml of solution. We will dilute it and we will provide to the patient. We will provide it in macro drops and micro drops. In macro we do have 8 and 16 drops. In micro we have 30 drops and 60 drops per minute. These drops are calculated per minute. Now what is macro and micro drops? Macro means more, micro means little. From one drop to the other drop, the time is measured how the macro and micro is seen. Like if you see, we have 8 drops, 16 drops. See, from one drop to other drop, we do have time, few seconds we do have. That is macro. But if you see here, 30 drops, 60 drops. In 1 minute, 30 drops. How fast it will be falling? We don't have that time we get in macro. So we have very little time, very little seconds here from one drop to other drop. That is micro drops. So this is how oxytocin is calculated. Prostaglandin is actually available in the gel form as well as in the tablet form. We have 3 options for it: misoprostol, dinoprostone, dinoprost. This 3 function mainly is to induce the labor by rupturing the cervix. Now, how the dosage is provided? Transvaginal, that is in the form of gel ointment. 25 microgram will be provided for 3 hours and 4 times it should be provided. Then automatically the normal delivery will start to begin. If it is oral, then 50 microgram will be provided for 4 hours. For every 4 hours it will be given. Then automatically the normal delivery will occur. When it comes to dinoprostone, here we have a dosage, it is an gel form and here 0.5 mg. It will be applied in the cervix region in every 6 hours. For 3 to 4 times after applying it, the normal induction of labor occurs, and this is the management of induction of labor. These are the possible questions from this chapter. Do practice well. This is the end of the chapter. Meet you in the next video. Until then, stay tuned. Bye.